Okay, so my name is Valencia Robinson, and I really don't have a testimonial of my own. I'm an HIV advocate in the state of Mississippi. I do a lot of work around reproductive justice, and I just want to talk about how Medicaid expansion, not expanding Medicaid in Mississippi, is criminal. Medicaid is the highest payer of people living with HIV. So they do a good job on that area. But people who work in the service industry, because I do have a job at a restaurant, because if you don't write grants, you get no money. So people are sick. They're dying. They have to go to the hospital to get services. People actually live in our emergency rooms. They make up excuses to go to have somewhere for shelter. Also, they come up with these mysterious illnesses because our state does not want to get this money, federal money. And I'm quite sure all y'all, you know that the denial of Medicaid expansion is criminal. Many Mississippians are denied because of the lack of affordable health care. Mental health is also lacking because people, we don't have any affordable services for people. And they rather lock people up with mental health illnesses than to get them the help that they need. So we really need to have an honest conversation about, even in the church, the black churches. I went to Black Lives Matter, and we had a conversation, black churches, do we need them or not? So we should have this conversation. When it comes down to health care, let's talk about teen pregnancies. With this contraceptives, we can't get contraceptives to our teens, but a 13-year-old can get tested for HIV without a parent's consent, but they can't access birth control. They can't access an abortion without their parents' consent. What mostly is happening is Mississippi is criminalizing sex. We have laws. We talk about sex workers, sex trafficking, and sex is natural. I know this about healthcare, but sex is about healthcare, about reproductive health, about STDs, about HIV, about mental health. So I want to go back to HIV. I have people that I work with living with HIV that doctors won't see them because of their HIV status. And they're not even going for HIV. They may be going for diabetes. We still have dentists that won't see our patients because they have HIV, because of the lack of education and the stigma around this disease. Our laws does not match what's going on. We have saliva as a weapon law here in Mississippi. It's an exposure law. A person living with HIV can spit on a law officer and get a felony. Anybody else that spits on a law enforcement agent officer, they just get a misdemeanor. And the fines are really expensive. So the laws doesn't match the science. And all these topics that we have, they're all intersectional. We can't talk about health care if we don't talk about mass incarceration. We can't talk about housing if we don't talk about domestic violence. So we need to all work together. And just Mississippi itself is a human rights violation. And we need to understand that. And we need to understand that because what we don't talk about, honestly, is race. Race plays a very big part of what's going on in Mississippi. And if we don't talk about race, we can't talk about anything else. We can't move further when we talk about Medicaid expansion, when we talk about food stamps, when we talk about housing. And I know all of this is going to be discussed. Some of this stuff is going to be discussed later. When we talk about gender issues, it's easier being gay than black in Mississippi. So just imagine if you're a black gay person. Sorry, so much. So when we talk about health care, we need to talk about holistic health care. We need to talk about if a person with HIV may have diabetes, and they only can be seen at a doctor for their HIV. We only have 28 infectious disease doctors in the state of Mississippi. And because of the lack of because of no Medicaid expansion, a lot of our rural hospitals are closing down. So that we have transportation issues because a lot of the hospitals that are closing down and clinics are in rural areas. So people have to get from rural areas to Jackson to utilize, to access their healthcare needs. And what if you don't have the money to pay somebody for gas? So that's how, for me, healthcare is inclusive of all of these other issues that we're talking about. You go get tested for HIV, you sleep with somebody, you can tell them, they get mad at you, they press charges, they file charges on you that you didn't tell them. You have, you have criminalization, like I said. So that's all I have time to say. I know it's a lot and I ramble, but I'm nervous.